If you're someone who sees a chiropractor twice a week for months at end, you might want to get a second opinion. I want to preface this by saying I do have friends who are chiropractors and I love the chiropractic profession, but chiropractors who keep you coming twice a week for months at end or indefinitely, they have a very old school mindset and literature shows otherwise. Typically these type of practices say that you're out of alignment and then they want you to come in for adjustments, which are just manipulations or grade 5 high velocity thrusts, otherwise known as grade 5 joint mobilizations. And typically you're not going to be out of alignment. By being out of alignment, that either means that your joints are subluxed or dislocated. A subluxation is just a mild form of a dislocation. And it takes a lot of force for that to happen. I'm talking like a significant car accident, or those of us who play collision sports such as football or mixed martial arts. It's possible there, but a manipulation isn't going to fix that. Some people ask, well, it feels good when I go to the chiropractor. Of course, it feels good because they take your joint to end range or the end of the available range of motion that you have. Then they give you a high velocity thrust to give you more range of motion, but it only sticks temporarily. And usually these type of practices don't give you exercises to reinforce what they did. If you are somebody who needs more range of motion, that's awesome. And a high velocity thrust is going to help out for a brief period of time, but you need to reinforce that with mobility exercises such as stretching, or you need to stabilize in that new range of motion with strengthening exercises. Also, some of these practices use x-rays to try to reinforce what they're telling you or reinforce what's wrong. But it's very easy to manipulate an x-ray, especially when you don't know how to read the x-ray yourself. Also, these practices typically use scare tactics as saying, oh, you have the worst back I've ever seen, or you have degenerative joint disease, which is just another name for osteoarthritis, which 80% of the population over the age of 55 has. And there's a lot of other people under the age of 55 who has it as well. And you know what's crazy? 40 to 60% of people who have osteoarthritis don't have any symptoms whatsoever. And I'm by no means advocating to solely go to the physical therapy profession. I'm a physical therapist, so I am a little bit biased, but there's some bad physical therapists out there too. There's PTs out there who just give you random exercises to do based on if it's upper body or lower body that really don't correlate to your symptoms or what's actually going on. And that's also complete BS. You want to go to somebody who's going to look at you on an individual basis and figure out what's the root cause of what's going on, what is going on, and how do we fix this? And then treat you on a personalized approach using evidence based care. You want to go to somebody who's going to use all the tools in their pocket to help you out if it's warranted. And hands on techniques actually are pretty helpful. I'm talking cupping, dry needling, Graston techniques, soft tissue massage, joint mobilizations, and manipulations, because if warranted, they can be very helpful. Also, using different kind of modalities and exercise, but more importantly, giving you the education you need to make corrections to your body and prevent things from reoccurring down the road. I'm just tired of seeing people get ripped off and scammed from practices that honestly shouldn't even be in business. Because remember, this is your health that we're talking about. You only get one body, so you have to take care of it. As always, follow for more PT without the boring lecture.